Polyps in MRCS Part A exam. For our next course for January 2021 exam, which will start in 15th of August this year, please go to mrcscourses.org. Page-Jigger syndrome, it is autosomal dominant condition due to mutation in LKB1 STK11 gene. It is consisted of numerous benign GIT hamartomatous polyps, as you see here, and hamartoma means just disorganized tissue. It's non-malignant. And also melanosis, that means pigmented freckles on the lips, face, palms, and soles, as you see in this picture. 50% will have died from GIT cancer by the age of 60 years. Insusception may happen due to intussusception, as you see, GI bleeding as oriented here, and the treatment is conservative unless complications develop. Other polyps, we have first classification of these polyps, either non-neoplastic inflammatory, like hamartomatous, as in Page-Jigger syndrome, or metaplastic, and metaplasia means change of epithelium from type to another type. Inflammatory, as in pseudopolyps seen in ulcerative colitis. Non-neoplastic polyps, as villus polyps, and tubulovillus and tubular 5% of cases. And villus is the most common, and also remember it's associated with hypokalemia. FAP, or familial adenomatous polyposis gene, it is autosomal dominant condition, consisted of at least 100 adenomatous polyps of the colon, and it's due to inherited ABC gene mutation on chromosome, long arm of chromosome 5, and it's autosomal dominant. Almost 100% chance to develop cancer by the age of 40, and it's also associated with duodenal carcinoma most commonly. Leigh-Romaini syndrome, it is autosomal dominant mutation in tumor suppressor gene P53. It is the same as P53. What is this syndrome? It is cancer predisposition syndrome associated with soft tissue sarcomas, breast cancer leukemia, osteosarcoma, melanoma, and adrenal cortex and brain tumors. More than 50% of individuals diagnosed clinically by the following, all the following criteria together must be fulfilled. Number one, a relative with sarcoma diagnosed before the age of 45, and a first-degree relative, like a parent, with any cancer under the age of 45. And a first or second-degree relative with any cancer under the age of 45, or a sarcoma at any age. Hereditary non-polyposis colorectal cancer, it is right-sided mucinous cancer associated with gastric and endometrial carcinoma. HNPCC or Lynch syndrome, hereditary non-polyposis colorectal cancer, or colorectal coli. FAP plus osteosarcoma in soft tissues and the osteoma of the mandible and desmoid tumor of anterior abdominal wall. This is called a FAP variant, Gardner syndrome. A FAP plus CNS tumors called Tariq's syndrome. Thank you very much.